FlexiGrip is a unique alternative to using the patient trapeze. The FlexiGrip is a soil-resistant nylon bed ladder with 8 soft padded handles that allow the patient to pull up and reposition themselves using upper and core body strength. This type of device is sometimes referred to as the Jacob's ladder. The FlexiGrip protects the caregiver's back by eliminating the need for the patient to grab onto the caregiver, causing injury to the caregiver. The FlexiGrip allows the patient to activate their own energy to assist in the transfer or activity. The FlexiGrip is translucent and can be used in MRI and CT scan applications. The FlexiGrip fastens to any stable fixture by looping through itself like a yo-yo string around the fixture, generally around the foot area of the bed or exam table. Always attach it in the pulling direction. The FlexiGrip eliminates the need for the trapeze in most every situation. With ceiling and floor lifts becoming more prominent in the care setting, the FlexiGrip will not interfere with any type of lift, nor does it need to be constantly tightened or pose as a threat for nurses to hit their head on. The FlexiGrip can be used for patient self-repositioning, in-room therapy, and wheelchair-to-bed transfer. Please, carefully read the instruction guide prior to using the FlexiGrip. Prior to using the FlexiGrip, visually inspect it for tears, excessive wear, and damage to the fabric, seams, and handles. If fraying of the FlexiGrip and/or tears in the material are found, please remove it from service immediately. Follow the facility policy and procedure for discarding slings and accessories. The FlexiGrips may be wiped down using a quaternary compound and left to dry thoroughly. The FlexiGrip can also be washed in 140 to 176 degree Fahrenheit water with a mild detergent and non-rinsing agent. The use of chlorine bleach will damage the material and reduce the life of the FlexiGrip. The FlexiGrip should be air dried if possible, as excessive tumble drying will result in damage and increased wear. Before securing the FlexiGrip to any fixture, make sure it is a fixture that is stable and secure, as it will need to support a large amount of pull force. Put the FlexiGrip around the fixture and then pull the handle side through the loop found at the end of the FlexiGrip. Pull tight to make sure the handles are all the way through the loop and that it is completely secure. Pull the FlexiGrip up over the mattress or exam table, and if compliant with your facility policy, lay the FlexiGrip next to the patient for use when needed. The FlexiGrip is ideal when a patient needs to sit up in bed or move from a supine position to sitting, moving their feet across the edge of the bed. When doing this, the FlexiGrip can then be used to keep the patient upright in the seated position if they need to rest. Place the FlexiGrip around the back of the patient and curl it around the shoulder. This will provide the back support to help the patient stay upright. When the patient is ready to stand, bring the FlexiGrip to the patient's lower back, and as they stand, use the FlexiGrip to help guide them up as you would a gait belt. By remaining in the room and fixed to the front of the patient's bed, the FlexiGrip is a useful tool for in-room therapy. The PT/OT or nurse can be in the room doing exercises with the patient using the FlexiGrip. The FlexiGrip can be used to activate the patient's energy to perform sit-ups and other in-bed exercises. Slowly walk up the FlexiGrip ladder by grabbing one handle at a time to the desired sitting angle, and then slowly walk down the ladder one grip at a time back to the laying position. The FlexiGrip can also help with wheelchair-to-bed transfers. Pull the patient up next to the bed in their wheelchair and have them face the foot of the bed. Give the patient the FlexiGrip and have them use it to help pull themselves up to a standing position and then move to sit on the side of the bed. For patients who are unable to bear weight, it can also be used when transferring a patient in a seated position using a transfer board like the EasyGlide and a footstool. Place the footstool under the patient's feet to reduce the friction under the patient's thighs to facilitate the transfer across the EasyGlide that spans the gap between the wheelchair and bed. The patient can now take hold of the FlexiGrip that is mounted on the opposite side of the bed and pull themselves into bed. Only allow the patient to do this if it is not contraindicated by the care plan. The FlexiGrip can also be useful in the bathroom setting as well, by helping the patient up from the toilet. Depending on the bathroom layout, the FlexiGrip can be attached to a grab bar by looping it through itself like a yo-yo string and placed within reach of the patient. Assure that the grab bar is properly mounted and can handle the patient's weight. The patient can then use the handles on the side of the FlexiGrip to pull themselves up to a standing position, up off of the toilet or wheelchair, one handle at a time. Taking the time to learn and remember these simple procedures will pay off in years of safe and comfortable lifting for you and those you care for.